reproductive health care, and women's economic stability. I'm Jill Horner. This is Comcast Newsmakers. With me is Maggie Leigh Groff. She's a board member for the Bucks County Women's Advocacy Coalition. Thanks so much for being with us.
Thank you.
You say there is a connection between access to reproductive health care and women's financial stability. What's the connection?
Oh, absolutely. There's really essentially nothing more fundamental than a woman being able to control when and she has children and how many children she has to help her to provide for her economic stability and independence.
And with that, you say there has been a family planning program in place since 1970. What's the idea behind this family planning program?
Yes, the family planning program, it's called Title X, was started under President Nixon actually in 1970, and a bipartisan group of lawmakers recognized that providing family planning services to low-income women especially, although the program now does provide services to both women and men, primarily women, would actually improve health outcomes, provide economic stability, make for better outcomes of pregnancies when they occur, and that when there were too many pregnancies that were closely spaced together, that led to more women in poverty, more dependence on public assistance programs, and generally poor health outcomes.
And with these programs, what are some of the services that are provided through Title X?
They are all preventive services, so they include birth control, contraception essentially, also all kinds of testing and screening, especially for breast and cervical cancer screenings, also general health screenings, blood pressure, that kind of thing, testing and treatment for sexually transmitted infections, HIV testing, a very broad range of general health care. And in fact, a lot of women, particularly who come to Title X health providers, that's where they get their only health care that they receive. And
so for women who may not have insurance, or for low-income women, as you mentioned, this may be their only access to a health care provider?
Absolutely. In fact, the Title X program provides services to women who make a little bit more money, so they don't qualify for Medicaid, but they're uninsured. And therefore, they're in a situation where they don't have health coverage in general. So being able to go to a facility like the Title X program is critical to them.
You have concerns, though, about proposed changes to the program from the federal level, and what these concerns not only mean for women's health, but also for women's financial stability.
Absolutely. So what this administration is proposing are dramatic changes to the program, which would prevent providers from providing a full range of information to patients, even when they ask for information about abortion, for example. It also would require that the program no longer offer all FDA-approved methods of birth control. So, for example, long-acting reversible contraception, better known as LARCs, is really the most effective, among the most effective methods of birth control, and IUD is an example of a LARC. These methods providers wouldn't have to offer, and they are expensive methods of birth control, so if women were not able to access these at a Title X health facility, they may not have access to them at all.
And I want to quickly ask you, we just have a short time left, but you were asking to people to get involved if they are concerned about this as an issue. There will be a comment period related to this, but people can visit your website for more information.
Absolutely. So when the government makes a change like this, this is not voted on by Congress. It's an administrative change, and they have a comment period available for people to comment on whether they think this change to this proposed rule is a good idea or not. And so we will have a link to how the general public can make comments on the changes to the program on our website.
Thanks so much for being with us.
Thank you.
We've been talking with Maggie Leigh Groff. I'm Jill Horner.